Hey guys, happy Monday. Whoa. So I'm gonna give you guys a quick update of what we did today. So I'm a lot of tired, not even a little. Like this weekend, I was partying back to back, like Friday, Saturday. I was working on Saturday and Sunday as well, so staying up till like 3 a.m. So yeah, today you can imagine I was super tired. Oh, and by the way, if you want to see what I did this weekend, head over to my main channel. It's RubyC and check out my recent vlog. It's a wedding/baby shower vlog, and yeah, the link will be in the description box below. Shameless plug, but yeah. So today my head was literally bobbing up and down like I was a rapper, like. Like I just could not stay awake, and it didn't help that the material was really really boring. So today we had both med surg and pharmacology. We started med surg pain management this morning, and then in the afternoon our pharmacology teacher came in and she talked to us about pain medication. So that's basically how it's gonna go. And so yeah, we did that in med surg. Everyone was falling asleep. It was super super boring. Like we had coffee, and it only worked for me for like 5 minutes until I just started feeling tired again. And so we had a late lunch because there was so much material. And so I went with my friends to Taco Bell. We were talking about how boring it was. Then we came back, we had pharmacology, and our teacher saw how everyone's face was just so over it. So she was like, you know what? You guys don't even look like you're focused. I'm going to let you guys go. So we were like, thank God. And so, yeah, now I'm home now. So I'll come at you guys tomorrow. Tomorrow, which is Tuesday, and Wednesday we have clinicals, and then Thursday we actually have off. I think it's a holiday or something. I don't know. All I know is we have off. And then Friday we have med surg again in class. I'm not really looking forward to clinicals, guys. I'm gonna keep it real, like, because they divide us into two groups. Like we have different instructors. So our main pharmacology teacher, she's our med surg, my group's med surg clinical instructor, and so she's still on with the bed baths and stuff. Basically everything I said last week where I was like hiding, that's all that she's making us do. And then meanwhile the other group that's at the other place, they're talking about how for clinicals they were shadowing nurses, and like they already started passing meds. We didn't even get there yet, and so can't wait till we do our switch. We are actually switching, like I said, at the end of this month. So we have 4 more clinical days until we do the switch, which means I'll have an extra hour of sleep because that's an area that's 5 minutes away, and I won't have to do bed baths anymore. So yeah, I'll probably come at you guys either tomorrow or Wednesday. I'm thinking Wednesday so I could just summarize how both days of clinical went. And then Thursday, you guys won't hear from me because I don't have class. And then I'll come back on Friday. So, yeah, guys. Bye.
Why are you running? Guys, happy Wednesday. So, clinicals are finally over for the week. So, yesterday, I'm bad. I didn't go to clinicals. I know. But for my school, we don't have to make up clinicals. We just have a certain amount of clinicals that we can miss depending on what subject. So for med surg 1, we're allowed to miss 2 clinicals. So that was my clinical day out. And so I have 1 left. So today we went there. I was partnered up. We had a patient. I didn't really have to do a bed bath or anything. Well, we didn't have to do a bed bath because the aide already did it by the time we got there. So all we really did was do vital signs, and I did the wound dressings along with my partner, and that was it. And so once again, we all finished early and we were looking for things to do. Once again, there wasn't much to do, so we were literally like scattered around hiding. I saw that what was it, the like activity staff needed help giving out the trays for lunchtime, so I did that. I did blood sugar for my patient, just basic stuff. So eventually we all finished. We all hovered around our teacher like, let's go. And so we had a post-conference, and in post-conference we had to give a report on our patient. And so the way that we give report this year is different from, well, this semester is different from last semester. Last semester is just like your report would be like, I did AM care, tolerated well, patient ate 50% of their food on the plate, flush G-tube flush G-tube with 30 ml, tolerated well, stuff like that. This semester, it's more like I had a 50-year-old male diagnosed with history of this, that, admitted on this day, on this diet, on these meds. So it was like that, and you have to know what the meds are for. So if you don't know what the meds are for, my teacher assigns you a med card. And this is the first time that we've ever done this, so I didn't even start it yet, but basically for the med card, like while you're reading off the medications for your patient, if you don't really know what it is, she's like, okay, that's going to be on your med card. So for the med card, she wants the brand name, the generic name, the classification, adult dosage, contraindications, patient information, like things you would want the patient to know, side effects. And so that's going to be due on Friday. And so that's basically how clinicals went. And so I'm kind of sad because there's this thing going on with bullying in my school regarding the nursing program in my nursing class. And it's been happening since last semester. And so I remember I told you guys that we were supposed to be switching clinical locations in November. Our teacher's now saying that is not the case. She's saying that our class is going to stay, but 2 of us are going to leave and go to the other location. And I'm kind of torn. The reason I'm torn is because the other place is 5 minutes away from me, which is great. But I love everyone in my clinical group right now. Like, if I were to write out clinical groups, this is exactly how I would have written it. And so that would be me going to, like, another place. It's just, I don't know. I don't know what to do. Yeah, and also like the teaching styles. My teacher teaches different than the other clinical teacher, and so I'm hearing a lot of positive stuff from that end. I do love my teacher, but I don't know, the other side sounds a little better, so I don't know, I'm really torn. I don't know if I should talk to my teacher or not to switch me, or if I should stay. I just don't know. But yeah, that's all that's been going on. And so tomorrow, like I said, we don't have class. I think it's a teachers in service. That's what it is. I thought it was a holiday, but it's actually teachers in service. So all the teachers, they go to school, but we don't. So I'm going to enjoy that day off. And then Friday I have a quiz for med-surg, our third med-surg quiz. And yeah, I think we're also having pharmacology. We're going to finish up on the pain meds. So that's all. So I'll come at you guys on Friday. Bye.
Hey guys, happy Friday. TGIF. Whew, I made it through the week, guys. So, yesterday, we didn't have school. We had like a teachers in service, so they went to school. We stayed home. It didn't even feel like a day off, honestly. Like, I woke up early. I didn't even get to sleep in. I woke up the time that like I usually wake up for school, so I was like, oh. And so, yeah, yesterday I just like tried to do the study guide for the quiz we had today. I did our group presentation work, which we didn't even have a group discussion today because we were running out of time. So I felt like that was an hour from my sleep that I lost. And then I did my drug cards. So yeah, today I was sleeping in class. I was trying my best to stay awake, but let me know if you guys ever have those like nights where like your friend calls you up, your bestie calls you up, like, girl, I got some stuff to tell you, and you're like, word, I'm trying to listen. So that's basically what happened. Like, my bestie called me, she had a whole bunch of stuff to tell me, and we stayed up until 3. And I usually wake up for school at like 7:30. She usually wakes up for work at like 6:30. So you can imagine we're both tired. So in school today, I was zoned out. We had our chapter 6 and 7 test. That was on pain medication. Yeah, pain medication and infection control. And so I'm so mad at myself because I didn't really study that much and I didn't get enough sleep. And so like I changed 3 right answers. Not 1, not 2, but 3. And we had extra credit, 2 extra credit questions that were worth 2 points each. And so I ended up getting 7 wrong, guys. 7. It could have been 4 wrong, but I ended up getting 7 wrong. So with the extra credit, my grade came out to an 80. And so I was mad because I'm like, if I didn't change those answers last minute, I would have had probably like an 87 or something like that. Yeah, I got an 80 on the quiz today, and I'm fine with that because that's my lowest grade so far. And for us, our lowest quiz grade always gets dropped. So that's just going to be dropped. So my average is still a 90 something in the class. And so, yeah, in med-surg today, we started like cancer patients and stuff like that. We didn't finish. And our teacher was really trying to squeeze all that information into like today, until the point where she was like, all right, guys, we'll just have to continue next week. And so we did that. I went on lunch, and then we came back. We had pharmacology. And then in pharmacology, in pharmacology, we finished up on pain meds. And we have our first quiz, like our med-surg / pharmacology quiz, on Thursday when we come back, because we have clinicals Monday, Tuesday, and Wednesday. And so I'm kind of scared. Like, she gave us examples of the questions she's going to be asking for that pharmacology quiz, and it's really like, you really have to know your meds now. Like, I was playing around before with like studying, as in like not taking it as serious, because like questions that you could easily answer, but these is like, I really have to crack down and study. I have to know what these meds do and what situation you would use it for and everything. So the contraindications, nursing implications, all that stuff. So I definitely have to study that. Like, an example of the question she gave, which this one was kind of like easy. It was like a man got into a car accident and fractured blah. The doctor prescribed him on a med, which most likely would be the med. So it was like Tylenol, Motrin, morphine, and something else. So the answer was morphine. And then it was like, there was another question that was like, why wouldn't you give someone with a head injury an opiate or something like that, or some type of like narcotic? And the answer was like, because it causes confusion. If the person already has a head injury, they're already going to be disoriented. Why give a med that a side effect is confusion? Like, that's kind of defeating the purpose. So questions like that. So I definitely have to study for that. But that's basically all that we did today. And she was going to start us off on cancer meds, but once again, she saw our faces, so she was like, nah. And yeah, so that has been my week. I will come at you guys next week. So yeah, that's about it. So thanks for watching, guys. Give this video a like, comment, and subscribe. Bye.